second rare cause of IVF cycle failure is uterine contraction during the transfer of the embryo. If the catheter that is used to insert the embryo within the uterine cavity touches the fundus of the uterus, and that's the top, the dome part of the uterus, or it is not done gently enough and it's inserted in a way that is a little bit rough, this will lead to immediate contraction of the uterus. Remember, the bulk of the uterus is actually muscle called the myometrium. So this type of rough transfer or touch or inappropriate touching of the uterine wall will lead to contraction, and contraction of the myometrium will lead to expulsion of the inserted embryo. If it doesn't lead to the expulsion of the inserted embryo, it can lead to the myometrium ending up being quite tight and the overlying endometrium being inflamed and also tight, and therefore less receptive to implantation. And in a worst case scenario, if the procedure was rough and the fundus was actually touched, it can lead to trauma of the uterus. Therefore, it goes without saying that experienced hands and the gentle touch of the clinician that is inserting the embryo is absolutely essential. I believe it will be possible for you to speak to your fertility specialist to find out if they've got any data in terms of how many IVF cycle failures for their clinic is due to lab or technique failures. And if your fertility specialist is willing to give you that information and you find out that the reason for their failures is mainly because of lab techniques, you want to run and find another clinic that you can go through your IVF cycle with.